Today on Living by Design, Tony Lamont presents Living by Design with host Kathy Holloway Hill. Kathy is a strong, powerful voice. She entertains, informs, and inspires her audiences everywhere she goes.
Hi, and welcome to Living by Design. I am so thrilled to have one of the most brilliant neurologists I know, and also my best friend, Dr. Karen Rodman, and we are going to talk about a very critical topic that I think a lot of you really need to know, and that's the topic of concussion as well as post-concussive syndrome. Dr. Karen, welcome to Living by Design.
Hello, lovely sister Kathy Holloway Hill. How are you?
I'm awesome because I love having you on the show. You are so knowledgeable and our viewers love you.
Well, I love your viewers and I love you all, you and Tony, and being on your show. Thanks for having me again.
Yes.
And thanks for helping me discuss this really important topic, post-concussive syndrome.
It is very important.
It is.
And we could just go ahead and start the conversation.
Absolutely.
Because first, let's talk about concussion, period.
Okay, concussion is a mild traumatic brain injury.
Okay.
Whereby people maybe can trip and fall, hit their head to the point where they may or may not lose consciousness. You don't have to lose consciousness. They have some persistent headache or nausea, dizziness, lightheadedness. And it doesn't have to be just from a fall. We can all be in car accidents,
Yes.
where you get head or neck injury. People, especially our young men who play certain sports like football or boxing, can get it. And what happens is with post-concussive syndrome, and maybe only 15% of people get it. The majority don't, but for those who do, you have a set of symptoms, which I will describe, which can persist for 3 months or more. And the symptoms commonly are headaches. It can be like a migraine, a muscle tension headache, or a back of the head headache, which we call occipital neuralgia, which is just a very bad back of the head headache, which just doesn't go away. Dizziness or lightheadedness or vertigo with spinning. Sometimes because of the dizziness, you sometimes get an unsteady gait, poor concentration, poor short-term memory, easily distracted. Sometimes excessive noise or light sensitivity, very occasionally ringing in your ears. So, and it's, those are the constellation of symptoms. You don't have to have all of them, but at least 2 to 3 that persist for at least 3 months or more. As I say, about 15% of people get it and others don't. They might get a headache, a little dizziness that lasts a couple of days or a week and then it goes away. But if it persists more than 3 months, you're into what we call post-concussive syndrome. And the thing is, you want to recognize this so that you get to the correct specialist.
Right.
And, you might say, well, if only 15% of people get it, well, who tends to get it? Well, if you're older, over 40, if you're a lady, a female, if you're a gentleman or a man or, even a young kid who does a lot of sports, especially involving boxing or football.
Right.
If you've had pre-existing falls where you've hit your head, so a recurrent fall, or if you have a history of alcohol abuse, or maybe even a pre-existing history of some depression or anxiety, they tend to get this more.
Okay. Lots of great information there.
Yes.
Now, let me ask you this question because I know you talked about some of the people who are more prone for this to happen to them to even get a concussion in the first place. How about young children who maybe they fail at daycare or maybe they were out playing with their friends and they fell and they hit their head? Are these the same type of things parents can look for and kind of pay attention to if they see their child?
Absolutely, absolutely. Again, I'm not a pediatric neurologist or a
Right.
pediatrician, but
Right.
certainly
But just as
children,
as a rule.
who get wounded, especially playing sports.
Yes.
Where they might fall and hit their heads or get beamed in the head with a baseball and may or may not lose consciousness, because you do not have to become unconscious to get this syndrome. Certainly, yes, parents need to look for that. And obviously, in that case, their pediatrician, or, if headaches or dizziness become a problem or behavioral problems, then a pediatric neurologist or a psychologist or psychiatrist may need to get involved. The key thing, and I think your question, sis, is just wonderful, is that you've got to recognize the whole constellation of
Right.
symptoms early enough,
Right.
so that one, you start the appropriate treatment for the headaches or the dizziness or the depression or anxiety or just poor memory or concentration soon enough.
Right. So if they notice their mood changes,
Absolutely.
or if they notice, they're complaining about headache or something like that, don't ignore it.
Absolutely. And I would say to people, headache, dizziness, be it lightheadedness or vertigo, sleep disturbance where you have
That's a
either
big one.
insomnia on one hand or excessive fatigue on the other, are probably the three top ones. And then just sort of a general poor memory, irritability, distractibility would be the next.
Okay. All right. Another really, really big area where probably see this is in a car accident when you get hit from the back.
Absolutely.
Because that whiplash, and that jerking of the neck, because I know a friend of mine recently had a car
Right.
accident, and not only did the neck jerk, but the individual also bumped her head on the steering wheel.
Absolutely.
Because it jerked back, then it jerked forward. So, with all of that head jerking,
Right.
that's a really big.
Absolutely. And I would say that probably car accidents, motorcycle, truck.
Yes.
But car accidents are probably the most common. I think you bring up an excellent point, which sometimes maybe obscures it for some people, because with a whiplash injury, you're going to have neck problems and
Yes.
neck pain as well. So some would concentrate on that and might say, well, the headache or the dizziness,
It's coming from the neck.
it's coming from the neck, or it's going to go away. Just, obviously let's, do the appropriate workup. And obviously, and you bring a good point, if you're in a car accident, either if you go to the hospital afterwards or go to your family doctor and they order tests as an outpatient, you're going to get the CAT scans of the brain, the MRIs of the brain, to make sure there's no fractures or there's no bleed or swelling in the brain. And of course, if there's neck pain from a whiplash, you'll get a CAT scan or an MRI of the neck. So that's the workup. And of course, in post-concussive syndrome, the MRIs and CAT scans, look normal.
Yeah.
Now, again, at a cellular level, you can have some disruption of the brain matter, which can bring on a lot of the symptoms. You can have a disruption, and, various experts say of certain chemicals, or what we call neurotransmitters, which we all have in our brain, which become disrupted, which leads to the various syndromes.
Right. Because the reason I ask that is because I know a lot of people, when they are hit from behind, they're so busy thinking about whiplash that they forget that the head could have some injuries as well. So don't ignore those symptoms, because they're very critical. Now, as you
Absolutely.
can see, we have a ton to talk about on this topic. So we're going to take a quick break, and we're going to be right back with more from the brilliant Dr. Karen Rodman. Welcome back to Living by Design, and we are having a great informative conversation about a very critical topic, and that is concussions as well as post-concussive syndrome, which could result from a concussion that you haven't paid any attention to. So, Karen, let's continue with where we left off.
Okay.
Some of the things that could bring on a concussion. Let's talk about one of the very important things that a lot of people may miss.
Okay.
Now, I'm not sure exactly what the stats are, so I'm not going to start throwing out stats. But let's just say there are a large majority of the population who are on antidepressants.
That's true.
Okay, so one of the symptoms of a concussion could be anxiety and depression.
Or irritability, absolutely.
Or irritability.
Absolutely.
So if you're already on an antidepressant, but you're noticing that all of a sudden it stops working, or you're experiencing more irritability. What should you do? Go to see your primary care doctor or a psychiatrist?
What you should first do is go to your primary care doctor, especially if they're the ones who prescribe the antidepressant in the first place.
Okay.
Now, if they didn't and you have a psychiatrist who does that, I would go to your psychiatrist. Obviously, because of the concussion, you could have more irritability, more depression, more distractibility, like my concentration's poor or my short-term memory is not as good. Then the prescribing doctor could say, well, because of this concussion, we need to, one, increase the dosage of your current antidepressant. Again, either your family doctor or psychiatrist. Or two, we may be at a point where we need to, if an increased dose doesn't work, switch you or change you to another antidepressant in the first place, which, can be done.
Now, do antidepressants help anxiety, or would you maybe need an anti-anxiety?
Well, that's an excellent question. There's certain antidepressants, Zoloft being one of them, that I can think of that can help both depression and anxiety.
Is Wellbutrin one of them?
Wellbutrin, potentially, yes.
Okay.
And then sometimes you need a medicine for depression, which is the antidepressant like Prozac, Effexor, Zoloft. Let me think of some others, Wellbutrin. And sometimes they need to add, if they don't help the anxiety, an anti-anxiety medication such as Ativan or lorazepam. Ironically, by the time...
Now, when you say lorazepam, you're so brilliant with your terms. Is that, does that equate to Xanax or
lorazepam
Klonopin?
is Ativan.
Ativan, okay.
And clonazepam is Klonopin.
Okay.
And what's interesting about those particular medicines, again, they can treat anxiety, but, and this is interesting, from a neurology point of view, they can be used to treat post-traumatic dizziness or vertigo.
Oh.
So sometimes they will say, and a lot of people, they find the dizziness or the vertigo or the spinning or lightheadedness to the point where if they get up and too fast,
that's what my friend,
they spin or they feel like they stagger.
Yes.
A neurologist, because normally they will send you to a neurologist, your family doctor will say, let's try you on one of several drugs. One, let's try you on Anavert, which is also called meclizine, and we don't have you take it as needed, but on a scheduled basis to try to avoid the dizziness, or we can try one of the anxiety medications, not for anxiety or it can help anxiety, but to help with the dizziness, because it's an inner ear, not a hearing part, but an inner ear balance type of thing. And again, you will probably almost always be referred to the neurologist for that, because by then your family doctor will say, well, let's see the neurologist. And of course, they will have done a CAT scan or an MRI of the brain usually to make sure, there's nothing, a bleed or a fracture or a stroke or something unrelated causing this.
Right.
And then they'll send you to a neurologist. And again, you want to get treatment as soon as possible. I would say headache, by and large, is the biggest symptom of post-concussive syndrome. Right. 30 to 90% of people can get it. And then for some, up to 32%, it can persist for months or up to a year, if not treated appropriately. And again, the headaches can be migraine-like with the nausea, vomiting, light and noise sensitivity. It can be the muscle tension headache where you feel like a band is just tightening. Or it can be the back of the head headaches or the occipital neuralgia. Right. And again, you'll get to a neurologist who'll prescribe a series of medications and or sometimes injections in the back of the head if you have back of the head headaches called occipital neuralgia.
So with all of these pieces of information that you're giving us, now if you're seeing some of these symptoms or you're seeing multiple symptoms that you're describing, you've got to get to a neurologist. It's now time to move past your primary care physician. They'll probably refer you.
Absolutely.
To a neurologist. And so a neurologist is more equipped, they're more knowledgeable about this condition, and they will determine whether or not your concussion has turned into post-concussive syndrome.
Right. And what ends up happening, and this is kind of sad, post-concussive syndrome, you have to have these myriad of symptoms I discuss for at least 3 months or more. Now, if you see it building up, things haven't gotten better or resolved within a couple of weeks, you're heading towards that. And that's when you need to be more aggressive, because ironically, neurologists like myself, at least in my experience, don't tend to see people who I will ultimately say have post-concussive syndrome until maybe their symptoms have gone on anywhere from 3 to 6 months. Because various doctors, have tried to treat pieces of it,
Right.
but haven't put it together, the syndrome, the headache, the poor
right.
memory, the irritability, the dizziness, the noise and light sensitivity, sometimes buzzing or ringing in your ears.
Yes. Right.
If we see that depression or anxiety or poor memory, especially at your job, is really persistent, neurology will say, well, let's get psychiatry and even psychology involved, because they do behavioral therapies.
Right.
And there are different types of antidepressants. And of course, neurologists are familiar with antidepressants because they don't just help depression and mood. In some situations, being on an antidepressant over a period of time can help with chronic pain.
And this is great. And and maybe this is a whole nother show, you can let me know.
Okay.
But one of the drawbacks of some of the, I guess, more anti-anxiety meds that you mentioned, the antidepressant, is that they are controlled substances because you can get addicted to them.
They aren't like narcotics.
Okay.
Antidepressants aren't. Now, some of the anti-anxiety, the Xanax, the Valiums, the Ativan, Klonopin, those you can get addicted to. The antidepressants, no, not so much. But if you've been on an antidepressant, let's say for a long period of time, and they want to get you off of it, let's say completely, they have to taper it off.
Gotcha.
That's not a controlled substance per se.
Okay.
The Ativans and the others, yes, you have an addiction potential, and they have to be in your right monitored and used carefully.
That's correct.
So that they will give you, whether you're using it for anxiety or if you're using it for post-traumatic or dizziness, used for a period of time or long term, they have to be monitored so that you don't become addicted.
Excellent.
You're absolutely right. You've noticed that, especially with the headache pain, I haven't mentioned, using narcotics. We can talk about that.
Yes, let's talk about that in the next segment, because we're going to take another quick break. And as you can see, we have so much that we're trying to help you with. So stay tuned. We'll be right back. Welcome back to Living by Design with Dr. Karen Rodman, and we are discussing post-concussive syndrome. So if you think you might have experienced a concussion and you are having symptoms, listen to this young lady right here. So some of the medications, let's go now to what the neurologist might recommend, because I know some of the other things we talked about, anxiety and depression. What are some of the more deeper, stronger medications you may give for headache or, some of those types of
And again, headache tends to be one of the main reasons they refer, headache and dizziness.
Right.
For headache, if I think it's migraine-like, I might put you on preventative medication, especially if they're persistent, like Topamax, which is topiramate. It's a seizure medicine, which is also used for migraine prevention.
Okay.
Kalen, which is also called verapamil, which is a blood pressure medicine, which is also used for migraine prevention.
So if your blood pressure is high?
No. I mean, for blood pressure, but we use it for migraine prevention.
Wow.
But it can also be used for high blood pressure. We might put you on, if we say, well, there's a muscle tension component, like a band, like it's just a band tightening in my head and neck. We might say, well, let's try some prescription muscle relaxers like baclofen, which is Leorasol, or Flexeril, cyclobenzaprine, which is commonly used. We might say, well, if, again, combination migraine muscle tension, we might use something in the Motrin family, like naproxen or naproxen. For headaches. Again, if the occipital nerve, the greater and lesser occipital nerves, which are sensory nerves, get irritated and you get really severe back of the head headaches that just won't quit, we might say, well, I'm going to refer you to a specialist, like an anesthesiologist, who'll do a nerve injection in the back of the head with steroids to treat that. Occasionally, if the headache is bad enough... Let me just answer this, we may put you on a short course of a mild narcotic, but not enough to get addicted, just enough to get some of the severe headaches away. Okay, so that way you might use a narcotic for a short period of time, enough to treat a very bad headache, but not enough to get addicted.
That's good.
So, sorry, sister,
Oh,
interrupt
no,
you.
no, you're fine. You're
What,
fine.
what,
You're
what
fine.
were you going to say about the injection?
Yes. You know, I had to stop you there. Oh, ouch. Just hearing you say that. So,
Okay.
and I know we're now into post-concussive syndrome symptoms.
Right.
And we're trying to help you guys out there.
Right.
But, oh my God, my head is spinning. It's so much information. So you're saying that whatever may be going on, that if the pain is coming from the back to the front, that somebody's going to give me an injection in the back of my head.
It may be one thing. First of all, we would make sure we get an MRI of the neck to make sure there's no really pinched nerve in the upper cervical spine giving you referred pain to the back of the head. With that being normal, you have some sensory greater and lesser occipital nerves which come off the spinal cord, which give sensation to the back of the head. And especially if you're in a car accident, have whiplash, that might occur. Now, you might say, oh, injection. Well, basically, it would be an injection done by a specialist. Now, some neurologists can do it, although it tends to be an anesthesiologist or a pain specialist who would say, okay, you know, you've had the brain MRI, that's clean. The MRI of the cervical spine, no pinched nerve. This is occipital neuralgia. We're going to arrange for, and it'll have a mild anesthetic combined with steroid, and they'll give you injections in the back of the head, in the scalp area, to try and initially deaden the nerve, and then the steroid part will treat the inflammation.
Wow.
Now, of course, a needle is not painless,
Right.
so there may be some discomfort, and usually what will happen is if you get set up for that and it's done, it might take a week, 2 weeks for it to kick in and work.
Right.
Okay.
But if it works, I'm sure,
Yes.
you know, if you're going through post-concussive syndrome, you got to be tired of those headaches.
Especially, and again, it's just one type of headache. I would
Right.
say migraine and or muscle tension headache, which I already talked about, are the more common ones. And sometimes neurologists will say, I'm going to add an antidepressant because, well, if you have some mood issues, plus some antidepressants, when they build up over a couple of weeks or a couple of months, can also help with chronic pain,
Yeah.
be it in the head or elsewhere in the body.
Yeah.
So,
Yep. Now,
We do that.
you mentioned earlier about athletes and some
Right.
people who potentially could, you know, have head injuries over and over and over.
that's right.
Talk a little bit about if that occurs in some of the more advanced type of medications
yes.
and tests and treatments.
Absolutely. Now, if someone, and are some of our wonderful athletes, boxers and gridiron football players are the two that come to mind. If they get, even with the right protective, let's say, headgear in football players, and obviously with boxing there is no protective headgear. If you
yeah.
get repeated concussion type injuries to the head, you can develop something called chronic traumatic encephalopathy. And I really think it should be chronic post-traumatic encephalopathy, which is just saying that because of repeated head injuries or head butting that you get, unfortunately, with these type of sports, you develop a syndrome where you have a progressive decline, unfortunately, in memory and other mental conditions, meaning your not just your short-term, but your long-term memory can become poor.
Yes.
You have a hard time doing activities of daily living, such as bathing yourself, feeding yourself,
Right.
taking care of your house, taking care of your finances, where you may need, more medications, especially from a psychiatrist, because you're going to have anger issues, aggression, you're going to have maybe mania.
You mentioned
right.
another type of, and it's another show, but you had mentioned another type of treatment that
Okay. Well, finishing up with the post-traumatic encephalopathy, you might develop seizures in that case. So you
Wow.
might see a neurologist, and chronic headaches and pain, for which you'll see a neurologist, or sometimes you have pain specialists. I did mention that there is a newer treatment. It's called quantitative EEG. And that is a wonderful another show.
Absolutely.
Where they will do an EEG with multiple, which shows your continuous brain waves, and you're not looking for seizures, you're looking for abnormal patterns that you can see in post-concussive syndrome or severe traumatic brain injury.
yes.
And what they do is, while they have you hooked up, you have a picture of visual cues on another screen, and then you get some auditory or music type cues to try to correct the damage from post-concussive syndrome, or the more severe, which again is another show, traumatic brain injury.
Wow.
Where people, have their skulls cracked, they bleed into their brain, they sometimes need brain surgery, and then prolonged recoveries. And of course, some of those people unfortunately die or stay into prolonged comas. And vegetative states, and again, that's another show.
And I hate to say that, but we know some of our beloved athletes have experienced that. I know Greg Page, he was a boxer, Muhammad Ali.
Absolutely.
There was a lot of people, and there are a lot of people. So we really want you parents to be very diligent in, what type of sports you allow your children to get into. So I want to say thank you so much, Karen. All of this information, if you ever need to look things up, please use Wikipedia. Wikipedia is a great source and resource for you to find information.
Yeah. If you say post-concussive syndrome Wikipedia on whatever search engine like Google, it'll come up. And I do want to say that the majority of people, especially if they get the right treatment, be it neurology, physical therapy, psychiatry, psychology, quantitative EEG, the majority of people will be symptom-free within 3 to 6 months of treatment, some by a year.
Excellent. So that's wonderful. Karen, you have absolutely been superb. We thank you so much.
I don't know about that, but thank you.
You're always great. You're always great. We want to say thank you. We hope you enjoyed this episode of Living by Design, and we will see you same time next week.